Thank you for joining us here this evening for the Rip-Off of the Week, brought to you by OpenTheBooks.com. My name is Adam Andrzejewski, and I'm the CEO and founder of OpenTheBooks.com. And you know our mission. It's every dime online in real time. Our objective is to capture and post online every dime taxed and spent at every level of government across the entire country. That's at the federal level, the state level, and the local level. So all of us together, we can follow the money and hold the political class accountable for tax and spend decisions. Today, I'm very excited about our segment. We're going to be talking about nonprofit hospitals, the largest ones across the country here in the U.S. that are actually making big profits. I want to introduce my co-host, Tamara Colbert. Tamara, do you feel that you're getting ripped off by government?
Adam, my family's been getting ripped off in the healthcare department for a decade at least. And, over $20,000 a year, that is not chump change, Adam. What can we do about this?
Well, look, what we found are these nonprofit charitable hospitals are getting richer while the American people are getting health care poorer. Your family's experience at $20,000 for premiums, out-of-pocket costs, and deductibles. That's actually the average that a family pays for their health care today. What we found, we decided to do this oversight report to begin to hold the industry accountable to the American people.
So there's got to be, we always start with some little nugget, and I would venture to guess that executive salaries has got to be a major part of this. Can you explain what that compensation is like for these nonprofits?
So what our auditors did is we looked at the largest 82 U.S. nonprofit hospitals. They're organized as charities, and we took a look at what they paid their top executives, so their most highly compensated employee. And we banded the compensation, and it's actually pretty stunning. 13 out of the 82 healthcare charities paid between $5 million and $21.6 million to their most highly compensated executive last year. There was 61 of these public healthcare charities that paid their executive between $1 million and $5 million. And then there was 8, which proves it's possible, that paid their top earner less than $1 million. And this was heartening because these are the largest charitable healthcare organizations in the country, and they did pay their top executive less than $1 million. Then what we did, Tamara, is we took a look at the last 4 years of compensation. And what we found was very troubling. We found that Ascension Healthcare out of St. Louis, Missouri, paid their top executive over a 4-year period a total of $59.1 million. And look, it wasn't an outlier, although that amount was awful high. We found that Kaiser, based in Oakland, California, paid their top executive $29.8 million. Banner, based in Phoenix, Arizona, paid their top executive over a 4-year period $29.8 million. Advocate Healthcare in Downers Grove, Illinois, paid $27.8 million over a 4-year period. Memorial Hermann paid their top executive $27.3 million. Northwestern Memorial, their COO, just out right here in Chicago, Illinois, got $15.3 million. And Tamara, this is not a non-for-profit compensation package. Identifiably, this is a for-profit compensation package, and these public charities need to be held accountable.
So what is the compensation compared to their asset growth? Because as you're mentioning, you're not getting a $26 or a $59 million salary unless you're bringing in quite a lot of cash. Is that federal money? I mean, what does that look like for these nonprofits?
So the federal government, studies have shown that up to 70 cents on every dollar of healthcare spending is driven by the federal government and its regulations and its subsidies. Now, you asked about the net asset growth of these charitable hospital institutions. So after they paid their chief executives all of this money, what was left? And on the latest year available, with our study of the top 82 public charities, we found their net assets grew by 23.6%. They put nearly $40 billion collectively to their bottom line in 1 year. Again, you're organized as a public charity. Healthcare costs are spiraling. These hospitals have fought the Trump administration tooth and nail to try to keep their prices that their patients pay for healthcare a secret, a trade secret. Keep it private information. They don't want to open their books, yet they're stuffing tens of billions of dollars to their bottom line while their CEOs are making tens of millions of dollars.
So if they're about keeping the money and they're fighting the administration, they've got to be spending a pretty penny on lobbying efforts, aren't they? What does that look like?
Well, we did find in our study that these 82 charities, the largest nonprofit hospital groups in the country, spend over $26 million lobbying to keep the status quo. They've got it really good, Tamara. Why would they ever want to change anything? Reform of the healthcare industry? Oh, look elsewhere. Look, you cannot use government money to lobby. You can't use donor money as a charity to lobby. So where did the $26 million come from? It came from you, the patient-generated fees that they spent to try to keep the status quo.
Right. They're essentially using my money to lobby against me to keep my prices higher. Right?
That's right.
What's happening.
And furthermore, they don't want to show you the prices, Tamara. They don't want to show you the prices. They just sued the Trump administration. President Trump did an executive order to open up the real prices that patients pay for healthcare for not only hospitals and healthcare companies, but also for insurance companies. He's taking on the opaque industry to open it up, to create a market, to go after the healthcare monopoly. We just want to be able to follow that money and to be able to comparison shop, to create a marketplace. And here's a simple analogy on what's going on in healthcare. It's like a football game, but the patients are wearing the blindfolds and the other side's running up the score at will through their executive compensation and through their net asset growth. The nonprofits are making big profits, and we want to create an open marketplace.
So creating that open marketplace, Adam, I have one word for you, and that is transparency and open the books. I mean, this is your thing. You are the transparency revolution team. Share a little bit about now how we can solve this problem by healthcare transparency.
So our honorary chairman, the former U.S. Senator from Oklahoma, the legend, Dr. Tom Coburn, and as many of you know, he passed away, unfortunately, back in March. But Coburn was a champion of healthcare price transparency. And he was a doctor, and he delivered about 4,000 babies in his small town. And here's what he said about the benefits of transparency. He said, the problem in healthcare is not that the markets have failed. It's that they've never been tried. The lack of price transparency in our healthcare system is driving up the costs, reducing access and quality, and giving patients an honest look at healthcare economies is one of the best ways to drive reform. And Dr. Coburn, we agree.
We do. And, he has left some really big shoes for Open the Books to fill, Adam. How can people, I noticed there's some great comments right now talking about we have got to enact more competition. It will drive down costs and premiums and healthcare overall. These are great. The people watching right now are extremely educated on healthcare. What can they do? Anybody watching this do to support Open the Books and your healthcare transparency initiative?
Right now, Congress, there are bills waiting in the United States Senate to continue to bail out the healthcare industry, even the wealthy nonprofit U.S. hospitals that have tens of billions of dollars in cash investments and endowments. And we need to raise our voice. We need to call our member of Congress and make them spend down that endowment before they take taxpayer money. And we're driving this issue, and we need your help at openthebooks.com. More More donations equal more investigations. Even if you're able to give us $1 a day, that's $30 a month. It goes a long way for us to be able to open those books and lock arms with you as together we hold the political class accountable for tax and spend decisions. We are partners. Please help our cause.
I want to say thank you to Chris and Willard and Carl and Ferris who are out there engaged. Please spread the word. Share this Rip Off of the Week segment on your Facebook pages and invite your friends every Thursday, 6 p.m. Eastern Time, to Open the Books Facebook page, because we're going to be back with a new Rip Off of the Week, and we want to spread the word and we need your help. So go to openthebooks.com. You can donate. Adam is right there in the middle of the fight. He's got the best team of auditors. And you can also spread the word by sharing this message. Sign up today. Go to openthebooks.com. Adam, boy, I mean, my blood gets boiling after every single episode. You get the last word.
Well, stay tuned. We've got more coming next week, Tamara.
Thanks, everybody. Have a great week. Stay tuned. Next Thursday, 6 p.m. Eastern Time, we'll be back for another Rip Off of the Week.